Have you heard about mini dental implants? Well, today in this video, I'm going to share with you everything that you need to know about the mini implants, when we can use them, who is the candidate to get them, and what are the plus and minuses for them. My name is Dr. Obeid. I'm a board certified prosthodontist and I practice in Chevy Chase, Maryland. This is a mini implant and this is a regular size implant. And the main difference between the two is the size. Usually the mini implant comes in 1.8 millimeter diameter and it'll go on to 2.2, 2.4, while the regular diameter implants is started from 3 millimeter and it go on to 5 and 6 millimeter in length. The other major difference is that the mini implants, they come in one piece. So there is no abutment. The abutments is already included in as a one piece, versus the regular implants will have multiple pieces, and you have more variety of abutments and more flexibility with the prosthetic components. While the mini implants, you have very limited choices and it must be placed in the right position. And that's why the indication for the mini implants will be for an area where you have thin bone or where you have small spaces. So we can use them for fixed crowns or to help support an overdenture. So if we look at these patients who came in and wanted to have crowns rather than wearing removable prosthesis, you can see the space were too small. So this is where the mini implant will thrive. And we end up placing two small mini implants with two different surgical protocols, where sometimes we can do the implant placement with guided surgery without the need to cut the gum, or we can do it conventional methods where we have to use a flap and mini stitches. The advantage of the mini implant as well, that we can provide the patient with an immediate fixed temporary in the same day. And when you look at the x-ray, you'll see how small these implants are. So there is no abutment, and then we can go ahead and finish the case with two permanent crown. So the crown looks fantastic. They function like any other teeth, and we have a very good track record of 10 plus years of success with these implants. And you can appreciate the before and after results. When we have patients who wear a removable denture, but that denture is loose and require a little bit more retention, we can use the mini implant in areas where we cannot place a regular size implant because the patient does not have enough bone. And in such a clinical situation, the surgery can be done without doing any cuts of the gum, and can be done with a procedure called Flapless dental implant surgery. Case in point, a patient who has been wearing an upper denture for some time, and it's not that stable anymore. So we place 4 mini implants, and those implants will provide the support and provide the patients with more retentions for their denture. And you can see on the x-ray how the mini implants look and compared to lower conventional implant. Areas where it is tight space, we can't put the regular implant. Mini implants is the solution, but it is very technique sensitive and require a lot of experience, because you don't have a lot of room to correct the implant position. This is why make sure, if you need to have one, to consult with a specialist, and they can help you make the right decision.